project the subcommittee structure. All right, thank you, Ni. Honorable members, we thank you for your time, for your patience. We've come towards the end of this program. On the screen, we have a proposal of who should make the steering committee for the legislative network. So we are proposing that the chair, Senate Committee on Health, should be the chairman of the steering committee, while the following members will be members of the committee. One, chair Senate Committee on PHC. Two, chair Senate Committee on Appropriation. Chair House of Reps Committee on Health. Chair House of Reps Committee on PHC. Chair House of Rep Committee on AIDS, Tuberculosis and Malaria. Chair Conference of Speakers. One chair State House of Assembly Committee on Health for each of the 6 geopolitical zones. That is, one state should nominate from each zone a chair of the House Committee on Health, one state per region. So one chairman House Committee on Health per region should be on the steering committee, and then one chair State House of Assembly Committee on Appropriation to also be. So that means we will have 2 House of Assembly members per zone. Each should come from a different state, and one should be the chair House Committee on Appropriation, the other one should be the chair House Committee on Health. So this is what we propose, and we want to invite members of the House to make comments. If it's okay, we can adopt. And if you think there are changes, we can make. So please, the floor is open. Any comment on the composition of the subcommittee, of the steering committee? Any amendment? Any amendment to the... So those who are in favor of adopting this steering committee say A. Those who are not saying nay, the ayes have it. Bam. Just learning from the television. So that is adopted. Can we have a round of applause for that? So we thought that this steering committee, when they leave, they should be guided by some terms of reference, and also we will hold them accountable based on that terms of reference. So can we scroll down to the TORs? Okay, so we have proposed the following terms of reference that will guide the steering committee. One is to provide leadership to the legislative network in terms of coordination, administration, and stewardship. So we know that they will provide leadership. The second is ensure that action plan for the network is developed, implemented, and reviewed regularly. So that they should provide leadership for action plan development and implementation. 3, serve as a springboard for facilitating implementation of health legislations, including National Health Act and statutory earmarking for health, such as Basic Healthcare Provision Fund at national level and Equity Fund at the state level. These are the things that we also hope they will be doing. Number 4, identify gaps that militate against effective discharge of lawmakers' duties as it relates to appropriation for health, oversight, and legislative function. So that to identify gaps and provide solutions. 5, they are to mobilize technical and financial resources from technical advisory group and other sources towards addressing identified gaps in legislative capacity gaps. So they will identify the gaps and then ensure that they mobilize technical assistance to address those gaps. Appraise performance of legislative network members based on agreed performance framework. The framework we adopted yesterday, they will provide leadership to ensure that we assess our performance at the end of the year. 7, promote learning and exchange of ideas among state lawmakers and between nation and state lawmakers. Exchange of ideas and learning. Keep network members abreast of emerging national and international health policy trusts. They should be able to look out for new ideas, new policy trusts, and ensure that members are aware of it. Keep network members abreast, okay, I've read that. Forge a consensus on topical national and state level health policy issues and present a common front on behalf of the network. So it's about consensus building. 10, create opportunities at national, regional, and international level for capacity building for lawmakers on basic health financing concepts and acquaint them also with the legal, policy, and social frameworks for health finance reform. So to provide opportunities both locally and internationally. 11, organize and hold quarterly and annual meetings. Encourage robust participation on the network social media platform and link members to targeted technical assistance. The platform, the digital platform we are creating, they should help in ensuring that it's active and also ensure that quarterly meetings do take place. 12, represent the network at the National Council on Health and other relevant national and regional events. When they work, if they find that that is feasible and it's something that they can do, it is the steering committee that should do that. So these are the terms of reference that we have written down and as a draft. So the floor is open. If members think that these terms of reference are not adequate to guide the steering committee, we can add some more. And if they think that some of the things that we recommended there are not feasible, we can also review and edit them or amend them. So, honorable members, any contribution on the TORs? Going 1, going 2, going 3, gone. Okay, it's not an auction. So I think that is wonderful. So we have come to the end of the steering committee and the TOR, and all the partners that have supported the planning of this will naturally transit into the committee that will be providing support for the steering committee. So the planning committee is not going to be disbanded. They will remain in place and they will provide all the necessary support and assistance for the steering committee. So my job is done. I would like to invite Olumide to invite, pardon? Okay. The next thing is to put up the communique. After due consultation, we have graciously agreed that the chair of Abia State House of Assembly, the Speaker of the Abia State House of Assembly has obliged and will do us the favor of coming on stage to read the communique. And so can we give him a round of applause as he approaches the podium? That wasn't loud enough, so he's still sitting on his chair. Another round of applause as he comes to the podium. Thank you.
So whilst the Speaker, Abia State House of Assembly reads, can we have some other speakers present in the room to support Speaker, Abia State House of Assembly, please? Please, let's join the Speaker. we will appreciate if at least one state, each of the states here are present. What state is not here, Madam, please? Legislature. Ekiti.
Good afternoon, ladies and gentlemen. I think on behalf of my colleagues from the 36 state assemblies of this particular country, may I, on their behalf, read the communique of action from the Legislative Network for Universal Health Coverage. We, the members of the National Assembly of the Federal Republic of Nigeria and the State Houses of Assembly, met in Abuja from the 24th through the 25th of July 2017 at a summit dedicated to the launching of a national legislative network on universal health coverage, UHC, at the invitation of the Chairman, Senate Committee on Health, Senator Dr. Olariwaju Teju-Osho, and under the chairmanship of the Senate President and Chairman of the National Assembly, Senator Dr. Abubakar Bukola Saraki, we gathered in Abuja to undertake a critical review and assessment of the statutory functions of the National and State Assemblies and how to leverage these for improved health, financing, and advancement of UHC. We recognize and commend the efforts of the ministries of health and related MDAs at all levels and acknowledge the support that the development partners, USAID, UKAID, World Bank, Bill and Melinda Gates Foundation, civil society organizations, and other stakeholders are providing in raising awareness around UHC and their delivery of critical technical support. Nigeria's lawmakers are deeply concerned by the slow pace of progress towards expanding health insurance coverage and financial protection to the majority of Nigerians and chronic underinvestment in the health sector. We recognize the legislative network on UHC as a veritable platform for harnessing and aligning the statutory functions of lawmakers towards achieving UHC in Nigeria. We consider UHC to be a worthy cause. To this end, we resolve to work towards the success of the legislative network on UHC and take all the necessary measures within our legislative mandate to ensure Nigeria makes significant progress towards UHC and work closely with the executive arm of government to ensure every Nigerian can obtain essential health services at high quality without suffering financial hardship. Under the specific underlisted legislative functions, we commit ourselves to: 1. Legislation. Pass appropriate health legislation and legal frameworks that mandate universal health care at all levels, e.g., laws establishing state health insurance/contributory schemes. 2. Ensure the inclusion of key clauses that guarantee financial risk protection, equity, and improved access to quality services are introduced into all health legislations. Appropriation. 3. Recall and reaffirm Nigeria's commitment to the Abuja Declaration of 2001, which recommends the allocation of at least 15% of government budgets to the health sector, and pledge to comply by providing increased health sector funding and ensuring at least 70% budget performance. 4. Ensure the inclusion and preservation of all earmarked funding for health, e.g., at least 1% consolidated revenue fund dedicated to the vulnerable population enrolled into health insurance schemes on federal and state levels. Accountability. Establish mechanisms to monitor progress of UHC with process, output, and outcome level indicators. 6. Work closely with the executive arm of government at all levels to guarantee the implementation of health laws and policies and ensure compliance with the rule of law. 7. Hold relevant ministry departments and agencies accountable towards effective and efficient implementation of UHC-related policies, related policies trust, including decentralization of health insurance scheme, PHC under one roof, PHC revitalization for UHC, and other policy trusts. Oversight. 8. Foster open access to information for improved transparency and accountability of health expenditure through effective oversight functions. 9. Employ a performance framework to track legislative efforts at actualizing UHC at all levels of Nigeria. 10. Provide oversight on UHC-related policy reform, including decentralization of health insurance scheme, PHC under one roof, PHC revitalization for UHC, and other policy trusts. We state that all the declarations in this communique are subject to the provisions of the law of the Federal Republic of Nigeria, and that in areas of contravention, the Constitution of the Federal Republic of Nigeria will take precedence. May I, on behalf of my colleagues, call for a motion for the adoption of this particular communique today, the 25th day of July 2017. Somebody to move a motion for the adoption. Let him be given a microphone from the floor for purposes of moving a motion to adopt this communique issued today, the 25th day of July 2017.
Thank you, sir. My name is Olusegun Ajanaku, a member from the Oyo State House of Assembly, having attended the 2 days program and having listened to the communique read to us. I hereby moved that the communique be adopted as read to us. Thank you.
Any seconder? Thank you. Any seconder?
Musa Tiladude are my names from Jigawa State House Assembly. I attended 2 days workshop relating to this communique. I so stand to second the motion read by my colleagues to adopt the communique. Thank you very much.
Ladies and gentlemen, the motion before us is that we adopt our communique thus read, dated the 25th day of July 2017, as a working document of this particular session. Those in favor of that particular motion to say aye. Aye. Those against say nay. The ayes have it.
Congratulations. Please stay. Please stay. Stay. Yes, please stay. Thank you very much. May I call Dr. Gafar Ladi on behalf of the Planning Committee.
On behalf of the Planning Committee of the Legislative Network for Universal Health Coverage, I would like to thank each and every one of us for the participation, for the contributions, and specifically, I would like to thank members of the National Assembly under the able chairmanship of the Senate President, who is from Kwara State, the same state as mine. I would like to thank Senator Lanrewaju Teju, who is the chair of the Senate Committee on Health, and other members of the National Assembly as well. I would like to thank members of the House of Rep here present. And again, I would like to thank members of the State House of Assembly, led by their respective speakers, Chair, House Committee on Health, House Committee on Appropriation, and other honorable members. Donor agency play a very important role to make sure this thing happen. So I would like to thank donor agencies that support this exercise. I would like to thank USAID, United States Agency for International Development. I would like to thank DFID. I would like to thank the World Bank, BMGF, and quickly some few and implementing partners as well. Earth Finance and Governance projects, the PACFA projects, the HP Plus, MSCA2, HSCL, and the media represented by SMPH. Quickly, I would like to thank, recognize some few individuals that play very, very important role. All of us play important role. But I would like to recognize Honorable Epo if he's here, because the whole legislative network started, okay, so on the podium, the whole legislative network discussion started February this year. Honorable Epo received a lot of training from HFG and has been the ambassador for universal health coverage. So during one of panel discussions, the panelists benefited a lot from Epo's contribution, and there was a suggestion, why can't we have a network, a standing network, where lawmakers will be sharing experience? And the rest is history today. We thank God that actually happened. I would like to thank Olumide Okunla, because immediately the discussion started when we met in Washington. Olumide said, let's go and see Senator Tejoso and discuss it now. And Olumide always shares something with us. He says it in Yoruba. He says, Baba Gafar, meaning that no single individual can solve this problem. We have to come together and do that. I would like to thank my boss, Elin Barua, because the day I admitted this idea to her, and we were thinking, okay, maybe we join this network with another initiative. She said, no, this is a very laudable idea that must stand on its own because it's very, very important. I thank her for that. I would like to thank Dr. Aremo. Is not here presently. He played a very, very important role. Dr. Aremo has been working with lawmakers at national level for many years. And he taught us a lot of things. It's from Dr. Aremo I knew that when you want to address a senator, you say distinguished senator. When you want to address somebody from House of Reps, the honorable member. So he did a lot of work. I would like to thank a member of the media represented by Mojima Kajola, a veteran journalist, provided a lot of support. Back to my own constituency, I would like to thank member of Health Finance and Governance Project. Juliana, if you are there, please stand up for recognition. Okay. Juliana did a lot of good job, and I'm very sure she must be having a troubling moment with her husband at the moment, because we took much of our time on this legislative network. And other members of HFG generally, and the members of the planning committee, we thank each and every one of you. Please pardon me if I don't mention your name and you contribute in one way or the other. So on this note, I would like to hand over to Olumide. Thank you.
So thank you very much, Gafar. We will have the last word from the Speaker, Bauchi State House of Assembly, and then we ask everybody to come. We need to close.
Closing in what way? No, I think he has done it. So on behalf of all of us, the leadership and all our members, in fact, including those that have been at homes, I want to say a very big thank you. I want to make a passionate appeal that in programs like this, in future, on behalf of all of us, we are calling on our senior colleagues and the development partners to see reason in going down to the level of state houses of assembly, because that's where the real support is needed. And for our senior colleagues, I will urge, instead of taking it as the last slab of the program, it's always advisable to, even if it's going to be a regional, that is this geozones representation in the infant stage of planning, because we'll have inputs, because we are closer than them. They are already now acclimatized with the good roads, free flow of water, and lights. All of us here, we are still in touch with the grassroots. So it's going to help a lot in doing things for the generality of the country. With this view, I say thank you very much, and wish each and every member of us safe journey marches back our various destinations.
Thank you very much, sir. Please, let's join. Let's have a group photograph. All parliamentarians. We have 2 levels. So. I think we would like to have the speakers. Let's have